Hi everyone, Dr. Remy from Pain Free and Fit. Today we have part 3 of our series on determining your neutral spine and using your RPI for your lower back pain exercises. We're going to combine body alignment with RPI tensions, making this a complete wrap-up of how to determine that neutral spine so you have a nice foundation for all of your healing lower back exercises. Hope you enjoy. So in parts 1 and 2 of our series, we discussed not only how to determine neutral spine through ranges of motion that were painful, and if you had a range of motion that was painful, you learned how to position yourself halfway between the extremes, whether it was a side tilting possibility of either the torso leaning side to side or hip hiking, or even a anterior or posterior pelvic tilting. We said that there are extremes of motion when you have pain, which when the tailbone comes up to increase the arch of the back, if at a certain point you feel discomfort, that's going to be one extreme. And if we put the tail under the opposite direction, at a certain point you may feel a little polar discomfort, that's another extreme. And the proper, correct position for you to position your spine in would be halfway or the midpoint between those to determine a neutral spine for that plane of motion. And we went through motions that included pelvic tilting front to back, hip hiking, side tilting, rotation, translations of the torso, the pelvis sideways, back and front with sway back and up and down. So that was in series 1, the first video on this topic. And then we discussed also body sway and how to determine if you have a probability with body sway. In video 2, we talked about how the body has a tendency to sway to one side. Usually it sways into its postural deviation. We gave you an example of left lateral flexion where if my typical posture has my rib cage leaning a little left, when I'm in an unstable environment, such as standing on one leg with the eyes open or closed, my first motion will usually be into that direction. That often is a direction that's going to be a pain indicator also. When we lean to the left, if I had a typical body sway left, when I lean to the left, oftentimes that's the side that's going to compress joints, discs. It's going to stretch muscles on the other side, and many times that's going to create a pain of the lower back, and we have to plug that into our rehabilitative exercises so that we design our program to emphasize the opposite or antagonistic motion to avoid that body sway and that position of pain. Today, though, we're going to take those two concepts and we're going to wrap them into basic body alignment and how to use your RPI to hold that correct body alignment. We all have postural asymmetries, and most of the time, due to our postural habits in our life, they're related in some degree to the experience that we have for our back pain, whether the origin is related to our disc, herniation, degeneration, spondylolisthesis, facet syndrome, synovitis, capsulitis, chronic strains, ligamentous hypermobility. Whatever the cause, posture and our movement patterns that we've developed through habitual practice throughout a lifetime many times has the answer in terms of how to prevent those pains. If we can harness our ability to correct our posture and avoid these painful movement tendencies, we many times have our ability to avoid the mechanical insult on these spinal soft tissues that cause pain. So in determining that, we start with a body analysis in terms of alignment. If you haven't yet done so, go to the Pain Free and Fit website or the Posturesize website. We have a free body analysis that will help you view your posture and your tendencies to move and see where you're askew. You may have a dysfunction in the feet that start the insult to your lower back. You may pronate or have one heel have a tendency to turn inwards. You may supinate. You may have a tendency to hold one knee in a genu valgus or a genu varus. You may have a hypermobile knee where you have a genu recurvatum, too much extension or loose ligaments in the knee where the knee falls back, and that's implicating your back pain. Every time you take a step, your knee doesn't have the right stability. There's a mechanical stress from the ground reaction forces of walking or running through your foot, through your knee, and into your back. It's affecting you. You may have a disturbance in the way you hold or stand or sit with your legs crossed. One leg turning out, external hip rotation, can cause a hip hike on one side where the hip comes up, compressing the side of the back and overstretching another. You may have a sway back posture where you stand with your hips more forward than your shoulder and ear. That presents a mechanical insult on the back. You may have a forward head posture that stresses the fascia and the muscles and ligaments that run from your head and neck all the way down to your lower back. You may have a side tilting posture where when you look at yourself in a mirror, the top of your hips may be hip hiking on one side, one hip higher than another, or the rib cage may be leaning down to one side. You may have a rotational posture where your pubic bone in relation to your feet being straight actually turns off to one side. That creates a rotational stress on the low back. Remember, the lower back isn't designed for a lot of twisting or rotation, so these postures in particular put a lot of stress on facet joints and discs. You may have a rotational posture with your torso moving to one side. So any of these types of mechanical disturbances can, from an alignment standpoint, irritate all those soft tissues in the lower back because they're designed for symmetry from right to left. We're not designed to have one side becoming compressed and or overstretched over a length of time. While we are designed to move in different asymmetrical postures, we're not designed to spend prolonged periods in asymmetrical postures and have those postures be our typical habit when we're lifting heavy resistance, when we're lifting weights, when we slip and fall, when we go through daily motions. By continually, repetitively overstressing soft tissues with asymmetry in the spine, that many times is the reason why our spines break down and why we have pain. So finding a neutral spine is putting those alignments from your feet all the way through your head, believe it or not, into better alignment, into a comfortable range of motion. You may have a scapular or shoulder blade problem where your scapula rounds or elevates or tips, or wings where the inner surface of the shoulder blade comes off of your spine. Maybe it even abducts where your arm comes out more on one side than another because your whole shoulder blade, the muscles around it have become imbalanced and your shoulder blade tilts to one side. All of these types of postures, that pulls on the lat muscle, which runs from your shoulder to your lower back. It affects lower back function. So getting a good body analysis and learning what your typical alignment problems are, what your typical movement tendencies are, that gives you a lot of insight in terms of how do I correct that to prevent lower back pain by putting myself into a neutral spine. So neutral spine, if we talk about it as a composite, means going through your alignment and trying to bring your alignment back towards neutral as far as is comfortable. Remember, if you've been spending years tilting to one side because that's the way you sit and work on your computer, or that's your activity that you do during the day, or the way you sleep perhaps creates rotation or lateral translation one way, many times you're not going to be able to come all the way up to exact neutral without irritating your lower back structures because it's too much of a change too soon. So with neutral spine, we work in trying to bring your alignment back into position in a comfortable degree. So in other words, if you can get exact straight ahead alignment and square body structure, great, but if you can't, you're going to have to stop just shy. You're going to try to improve that alignment as much as you can, but still be comfortable without irritating pain. That's paramount to setting your neutral spine. You also want to be concerned with plugging in that body sway, because if you have a tendency to go to one side, when you're trying to hold your neutral spine during exercise, you're particularly going to resist that tendency to lean that way or to sway that way. You also want to be cognizant of that range of motion or middle point. For instance, if you realize that your typical body posture is tail up, anterior pelvis, where your tailbone is higher than your pubic bone, you only want to put it under to that midpoint between too much tail up creates pain and too much tail under creates a little pain. You want to put it in that midpoint. If you don't put it in that midpoint and you have the tail under just a little bit trying to correct an anterior pelvic tilt, and you go to do your exercises and you don't have exact form and you don't have perfect control of your spine, you're not going to have as much leeway or safe zone to be able to correct from that mistake. If I'm having my tailbone up and I'm doing a plank, for instance, and a front plank where I'm on my hands and my toes, if I am holding that and I'm getting fatigued and I don't have that midpoint position but just a little pelvic tilt under, what's going to invariably happen is when I start to lose control, that tailbone has a shorter distance to go up into the stressful range of motion that's going to irritate my back tissues. So I want to keep that tail under that midpoint so I have a safer range. If I do make a mistake, it's not going to go to that extreme that caused the pain that I first identified in my analysis. So proper neutral spine consists of all these planes of motion, bending forwards, backwards, side to side, translation, up and down, that we've indicated and explained in the first two videos, and setting your spine in a more neutral alignment that's comfortable and in a range of motion in a plane that causes pain in the center of the two extremes of pain, so you have a good safe zone that's going to decrease the stress on the tissues that are painful. And That cannot be determined by an MRI or X-ray. It can be determined only through your analysis of your body and how far you can move. Sometimes it even change from day to day or week to week, depending on the stresses that are going on in your spine from your daily activities. Finally, using your RPI, or reverse posture isometric, is key to learning how to hold your neutral spine, because we can put a neutral spine in by just positioning, but we need to hold that for the purpose of our rehabilitative, corrective, healing exercise program that we're trying to design for our lower back. So our RPI entails figuring out what muscle instability issues do we have where it's not stabilizing the joint either on a local basis, like the multifidus muscle we've discussed previously, which is a small muscle that comes off the center of your spine. If you don't feel the multifidus equally from right to left on those midline bones, or as you draw your lower abdomen in, if you don't feel the right and left sides of your lower abdomen coming in equal, that indicates a local problem, either with the internal obliques, the transverse abdominis, the multifidus. You need to learn how to correct those so those muscular supports are symmetrical and correct in helping to hold that joint stability, that alignment, that neutral position that you've set. If you have a problem like spondylolisthesis and the bone is sliding forward, you need those deep longissimus and iliocostalis fibers in your lower back to fire to help hold in a backwards direction that vertebra to prevent its tendency of moving forward. That can be learned on other videos. We've talked about multifidus, transverse abdominis, internal, external oblique rotations and relations. Quadratus lumborum, people that hip hike a lot on one side or lean to the side, they need to engage the quadratus lumborum on the other side to hold themselves in a more neutral position, to check that tendency to go into that side. They need the opposite side to contract to hold them in a neutral spine. That's your RPI, reverse posture. You're trying to move in a reverse posture. If your posture is hip hike and side lean, you want to contract the opposite way. That's why it's called RPI, reverse posture. If you have a dominant lat muscle, the lat we said runs from the shoulder to the lower back. That's a key stabilizing muscle for the lower back. The lat attaches to the thoracolumbar fascia, which runs across your lower back and attaches to the opposite buttock. So if you have a weak glute or a weak buttock on one side, and we have on your analysis on the website painfreeandfit.com or posture size how to determine that, and if you have, let's say, a dominant lat on one side, if a glute is weak, let's say in this example, and its opposite lat, which connect and work together, is dominant, you're going to have an asymmetrical force pulling up laterally and superiorly, or to the side and upwards, on those vertebrae, because the lat's working too much. The glute, which is the opposite partner in that stability system, is not working enough. So you want to learn how to relax that lat, contract the other one, and wake up or activate that weak glute so there's symmetry and harmony in its tensions of stability across those joints. So RPI is simply the positioning of our body along with the correct muscular tensions to hold it there. And so many of us with the lower back pain have these abnormal tensions. We have asymmetry between our stabilizing muscles. We have alignment problems. We have body sway problems. Our neurological systems have learned to sway one way, to use muscles asymmetrically, one side more than another, through habitual practice, and that coordinated activity happens when you're working out, when you're going through your daily activities. So we really want to know what our neutral spine is before we even start to think about developing our pain-free and fit exercise healing program of whatever it is, whether it's a shoulder, a neck, a lower back, a knee, a hip, an ankle. We want to understand what are our mechanical tendencies, how do I hold them in a neutral or safe position, and what muscles that stabilize that area need to be focused on and learned how to be coordinated so we can contract those to help hold us in a safe position. If you like this video and would like to learn more, feel free to subscribe to our channel. We've got a lot of great videos on healing exercises for various body parts. If you'd like to help me share this valuable information with others, give me a thumbs up below. Questions or comments, write in. I'll do my best to answer them. If you're looking for a tailored exercise program for your unique pains, whether it be back pain, neck pain, shoulder pain, go to the painfreeandfit.com website. We've got a lot of great tailored programs there that teach you a full body analysis of your region of complaint, the appropriate stretches, the muscle activation and muscle stability exercises you need, the ability to figure out how to coordinate proper movements, the strengthening and conditioning exercises, teaches you pain relief exercises to get you over pain when you're going through a bout, nutrition, and how to incorporate a program that takes you from not being able to do a physical activity or sport because it causes pain, and how to self-rehab and strengthen your body through stability and conditioning to get back to those activities without aggravating. I hope this series, both the part 1, 2, and today's 3 on neutral spine positioning, helps you with your chronic lower back pain.